Good Friday morning. It is November 19th. Welcome into the Morning Medical Update. On today's show, if you wonder why face masks and COVID vaccines are so important, well, new numbers this morning show just what can happen if there is no mask mandate in your county or very few people getting the vaccine. We will show you startling statistics when it comes to the death rate due to COVID-19 in counties that have had issues with both of those. So, plus, we're going to tell you where you can get a free vaccine this weekend and celebrate your Kansas City Chiefs. So, kind of a 2-for-1 there.
Yeah.
Very
the winning
cool.
Kansas City Chiefs.
Yes,
The
yes.
winning. There you go. Okay.
Dallas Cowboys. Okay. So make sure you get your questions sent into us on YouTube, Facebook, Twitter, and the Medical News Network. You can find links to those right there on your screen. Okay, before we get to Dr. Hawkinson this morning, I have a really great opportunity, Dr. Stites, to get my booster vaccine right here. Let's just get it out of the way.
The FDA
Bethany,
just
nurse
said,
Bethany is going to do it now because she's got to get back and take care of patients. So I'm going to just roll it up. And I said, what arm should I do? And you said, well, what's your arm you use? I said, right. You said, do the left. I didn't really think about that.
Well, that's why I always
It's not going to hurt, right?
No, not
Are you
at all.
left-handed?
I'm right-handed.
And while you're
So
getting this shot, can we just say the FDA just came out and they are now recommending boosters for all folks over the age of 18, whether you have a history of disease or
This is
whatever. Everybody should get one.
Okay, this is it.
Yeah.
Easy peasy.
Is that what you sing?
I did.
Uh-huh.
I'm not as good a singer as you, of course.
Yes, you
but
will.
Who
Yeah,
is?
It's a big bar.
Bethany, thank you for doing this.
Yeah, happy to.
Hey,
Love
thanks.
getting people vaccinated.
Well,
Boosters
mark
are
one off
important.
your list today. Thank you very much. Okay, have a great
Excellent.
weekend, Bethany.
Well
Appreciate
done,
you.
Jess.
Thank you, right?
That's good. No,
Like
that's a
it.
good thing. And
One
like I
more.
said, it's a big deal. The FDA has authorized it. It's got to go to the CDC. We fully expect them to authorize it as well. That means everyone over the age of 18 is now going to be eligible for a booster. You don't have to have any chronic disease, et cetera. You just have to have an age. And I think that's a really good thing because we want to get as many Americans to get the booster shot, maintain their higher level of immunity so we can help end the pandemic. So well done.
Thank you. Can I get a little Friday
You
fist
do.
bump? Friday
Well
fist
done.
bump.
I
I
like
love
it.
it. Okay,
Well
so do we have any reporter questions today, by the way? Well, let's do our COVID count, then we'll get to reporter questions. Dr. Hawkinson, good morning to you.
Yeah, hi, how's it going?
Well, it's good. I just got my shot. So
That's good, that's good.
You did not throw away your shot.
I did not throw away my shot.
Today at the health system, we have 23 active infections, so it's gone up just a little bit, unfortunately. 9 ICU patients, luckily only 3 of those are on the ventilator. We have 3 of our 23 active infections that are fully vaccinated. We still have 19 in that recovery period as well, so a total of 42. And Hayes has 12 active infections and 7 in that recovery period as well.
And that's a lot for Hayes. And just to say, the numbers across the country are up 33% in the last 2 weeks. And fortunately, Wyandotte County last night voted to extend their mask mandate until January the 6th. Well done,
I was just going to say, how happy does that make you?
It makes me really good. The Dodd did a great job, and we wish all the counties had done that. That's not what's going on around our metropolitan area, as we well know, or throughout either our bi-state area. So I think Wyandotte really took a great, bold step. I know it probably wasn't the most popular thing, but it is the safest thing. And we see what's happened to the numbers, and we're going to get into that discussion. But we know what's going on locally and nationally. We know it in the wastewater testing. We know it in all our statistics. The next surge is at our doorstep. So I'm glad Wyandotte did that.
Yeah, Wyandotte leading the way. We love that.
Well done.
Okay, so before we start our conversation and get too far in, any reporters on the line today? Okay, gone. We're good. Okay. Well, there's a lot of misinformation out there about COVID-19 and the vaccine, but what we're going to show you should help clear some of that up. We're going to take a look at this graph. It shows you the death rate among every 100,000 people who got COVID here in the metro. You can tell there are some counties that are worse off than others. So the big question then is why? So joining us to talk about this is our numbers gal, and we love it when she is here. Dr. Amber Schmidtke is joining us. She is an associate professor of biology and chair of Division of Natural Sciences and Mathematics at the University of St. Mary's. So thank you for being here with us. We love it when you're here.
It's a pleasure to be back.
You lay the numbers on the line for us and really break it down. Of course, Dr. Stites joining us. And also today, we're glad to have Jake Dodd. He is the one who authored the study that we're going to be talking about. Hey, Jake, how are you?
I'm well. Thank you for having me.
Yeah, great. Okay, so I know you and Dr. Schmidtke have worked together. You're one of her students. So I'm going to start with you. Just tell me about how this study came about and what were you hoping to find out? Kind of run through all the background with it.
Sure. So I'm a senior biology student at the University of St. Mary. In this semester, I'm taking a research course with Dr. Schmidtke, and we decided that our research would would be an investigation of COVID-19 disease trends in the Kansas City metro area, to sort of see if a different trend or different elements really are affecting death rates. And so what we found was that what we did was we found the cumulative death rates in each of the 9 counties in the metro area, as well as the combined metro average death rate, and compared those. And so what we found was that there were a number of counties that had death rates higher than that metro average, and a number of counties below it. So it made us think, why is this happening? Is it because of vaccination rates, or is it because of ICU bed availability, or because of the implementation of a mask mandate? And so that's where we took things next, as we went ahead and looked at mask policies within all of the 9 counties of the metro area. And so, and so what we found was that that in counties that had that did not implement any sort of mask policy, they had death rates 24% higher than
Slides he's talking to.
Sorry.
Oh, no, I just wanted to make sure we're showing the slides, because that helps us,
Okay,
Jake.
yeah,
I'm going
yeah.
to just tell the guys to run your slides, so we hopefully
Yeah,
you can
no
see
worries, no
those.
worries.
Okay, go back, though, and show us what we're looking at. Look at those slides. Sorry about that.
Sure. So that's the
Help us
first
with
thing I
that.
was talking about. That's the cumulative death rate of each of the individual counties in the metro area compared to the metro average. So you'll see that there are a number of counties above that average and a number of counties below it. Right. So now we're trying to figure out, why is this happening? Is it because of vaccination rates or ICU bed availability, or the implementation of mask mandates? And so that's what we looked into. We researched mask policies in the Kansas City metro area, and that's going to be on the next slide. And so you'll see that in counties that did not implement any sort of mask mandate, they had death rates 24% higher than counties that did implement a mask mandate at any point in time during the pandemic. And you'll see those counties highlighted on the left. All 4 of those counties have death rates higher than that metro average. And so after this, we went ahead and looked at ICU bed availability to see if this had any sort of influence on death rate. And what we found was that in counties that didn't have any ICU beds available, they had death rates 29% higher than counties that did have ICU bed availability. And you'll see on the left, those 3 counties highlighted all have death rates higher than that metro average. And along with this, those counties are among the 4 that didn't implement any sort of mask policy during the pandemic. So that's a really concerning statistic.
And so I'll take it from here. What we're looking at on the next slide is what happened with vaccination rates. And so what we looked at was the death rate among counties where the total population had a vaccination rate that was at or above the median, or the sort of the midpoint average for the Kansas City metro. And we looked at those that were below that average. And we looked at that for the total population, and that's what you see in orange on the right. And we also looked at for the population that's over the age of 65, which you see in blue on the left of that bar graph. And so what you can see here is that we saw a really big difference here. When you looked at the age group 65 and up, we saw a 36% increase in the death rate for counties that had that below average vaccination rate. And then when you look at the general population, it's even greater. It's 68% difference. So this was actually probably one of the most important things that we found, was the importance of these vaccines. And if you look over on the left, you can see that, again, those same 4 counties that we've kind of been tracking throughout this entire thing that we've shown you today are among those that have that below average vaccination rate. And so really this kind of creates the perfect storm. And so if we can advance to the next slide, I was just going to say that some of our big take-home messages here are that the counties that had low vaccination rates, that didn't have an ICU bed available, and that had no mask requirement were the ones that had the highest death rates in the Kansas City metro. And so if you're one of these counties that doesn't have ICU beds available in your hospitals, maybe you need to think hard about, maybe it's time to implement a mask requirement or to surge vaccinations in your area, because you just don't have that infrastructure to overcome that problem. But the other thing the other piece of data that I've brought to you today on the upper right is that we can see a very strong association. When you have high case rates, it results in high death rates. And that's for the Kansas City metro. And so really, if we want to prevent deaths, the key is to prevent cases from happening in the first place. And if we look at the graph on the bottom right from the New York Times that looks specifically at the Kansas City metro, we can see that cases are rising. So it's really incumbent on our leaders at this point to really think hard about what steps they're going to take to try to save lives this winter.
So my big question, now what? That's
Well,
where I
no,
look
we know
at you
exactly.
guys.
No, we know what to do. We know what exactly to do. A, you got to get people vaccinated. B, you got to wear a mask. And it's funny how much we fight masking, because every time we take the masks off, things are great for a while because it's time to party, and then pretty soon the numbers start to go back up, and we have a combination of taking masks off, which I think is just fine outdoors. I think the data about being outdoors is pretty strong. But as soon as you take the masks off in weather getting colder, and then you have people coming together or Thanksgiving and Christmas, we're going to duplicate what we did last winter. You say, well, we have a lot of people vaccinated. Well, we do. We didn't have many people vaccinated last winter, but Colorado has more people vaccinated than we do, and they're having a really major surge, their worst since a year ago. Michigan and Wisconsin and Minnesota, all with higher vaccination rates than Kansas and Missouri, are having a terrible surge. And again, it's the same thing. This is now the pandemic of the unvaccinated, right? We've shown time and again that the rate of COVID is 6 times higher in those who are unvaccinated, and the rate of hospitalization death is 12 times higher in those who are unvaccinated. So, it's a pandemic of the unvaccinated. There are still a lot of vaccinated people. And the second argument comes back, well, a lot of people have had COVID. Right, a lot of people have had COVID. That does not give you the lasting immunity that vaccination does, especially with the Delta variant. So it's always amazing to me. People will go take whatever drug they want to off the internet. They said it was going to be great. There's no studies. There's no way to document it. They can put anything they want to in all those protein building formulas, body building formulas, weight loss formulas, all that stuff. You're going to take it. But you're not going to take a vaccine that's been given billions of times, has had more study than any vaccine ever in the history of mankind, and has had more data accumulated around it. And yet people will still not take it. It's like, okay, well, I don't really fully understand it, because what you're really doing is just listening to internet news, and that is not news. That's just internet rumors. So at the end of the day, the answer to this is numbers are going up. They're going to keep going up, and we have to confront that, and the only way to confront that is masking and vaccination. And I know, Hawk, that was a longer rant than I probably should have, but anything?
No, it's simple. Medically we know what to do. We know how to prevent illness. We know how to prevent transmission and things to do. And sometimes it is hard, but unfortunately that is what we have to do right now. And again, it's not just about the cases. We're not just talking about the cases. We're talking about hospitalizations and really keeping people well. Also reducing the chance of getting long COVID. We know that the vaccines do that now. We have good data to support that. And this goes for the children all the way up to the adults, so that you can still have a good quality of life. We really want to keep people, loved ones, friends out of the hospital, keep hospital capacity, keep you from having to go to the ICU, from dying. We know that this is a very preventable outcome, and it's preventable, number one, with vaccines, and then number two, doing those non-pharmaceutical interventions that you talked about, Steve, in those high-risk situations, just like you said. So we know how to do it. Unfortunately, it is coming at a time now where we are wanting to gather more and see friends more in those high-risk situations. But, if you do that, please encourage those people that you're with or will be with who haven't gotten vaccinated to go get vaccinated.
Hey, Jess.
Yeah.
Knock, knock.
Who is there?
COVID. COVID at the door. Mm-hmm. And all you have to do to keep it out of your house and keep yourself safe is wear a mask and get vaccinated.
So back these guys up then, Dr. Schmidtke, because we talk about getting the vaccine and wearing our masks. It seems simple, but when you and Jake are entrenched in those numbers and you're talking back and forth and you're going, here's the proof right here. What is surprising you as you start to sift and get deep into those numbers, and what do you really want us to take away from that research that you guys are doing?
I will say Jake is relatively new to this. He's been doing this for this semester only so far, and it's been a great experience for him. But what I want to say is that I've been in this since the start of the pandemic, and tracking these numbers for this many months, it gets wearing, right? You get to the point where you're just like, we're just tracking numbers and nobody seems to be paying attention anymore. And this is really our chance to remind you that these numbers matter. And these are not just numbers, they're people. These are loved ones that are in the hospital. These are loved ones who are dying, and we really want to prevent that this year. The holiday season is the sort of thing where we have a frequent tempo of gatherings of people that love each other. And what we don't want to happen is that you get exposed at one of these things and you carry that forward to the next family gathering or the next holiday gathering. Christmas is only about 4 weeks after Thanksgiving. New Year's is only a week after Christmas. So we're sort of running the gauntlet in a minute here about, the kinds of exposures that we're really worried about. And so that would be just one of the things I would point out. And the other thing, just to back up what the doctors here have said, is that vaccines are incredibly important, but they're also just one of our tools at our disposal for preventing transmission. And so that's going to include things like wearing a mask, being socially distant, taking advantage of testing before you gather. Those are all great things to be doing right now.
So is it kind of like Russian roulette where, and you mentioned, Thanksgiving, and then here comes Christmas, and here comes New Year's. It's like, do you think it factors in that people have taken those small risks, Dr. Stites, too? Like, I went to a Chiefs game and I didn't get it, and I went to work
Right,
and I hung out with friends at a bar and didn't wear a mask and didn't get it.
It's just like Russian roulette, right?
And
you do what you want outside. We've said that for a long time now. We weren't sure at first. Just keep your distance outside. Now we're like, no, it's fine.
like I haven't gotten it so far.
Yeah,
What's another holiday going to do?
We're not seeing the big burst from the Chiefs games. We're not seeing the burst from the Royals of the sporting. But when you go inside, it's a different story. And you may be fine a couple of times until you're not. I'm 61 and a half years old, so I have a history of prostate cancer and things. So, there's a risk for me to go and be around somebody who has COVID. And I just as soon not do that. And I'm fully vaccinated. And so, I think the problem is you'd go inside, someone may not have been vaccinated. And let's ask ourselves this question. If you have your friends and family who have gathered together, how will you be next year if that number of people you had is n minus 1 or n minus 2? And you don't know when that can happen, but how will you feel if that happened in your home, with your family, at your gathering? Was it really worth it? Here's what we know. Vaccines are amazing protection against death. It's an amazing protection against long haul. It's an amazing protection against n minus 1. Don't do that. Don't allow the n minus 1 in your home or your household. It's not that hard. And you can keep people safe. And you'll never know when n minus 1 could be you.
Well, it hits home because I feel like this is even though we've had this vaccine for 9-10 months, that the same thing you just said is something that you said this time last year.
Oh, I did.
Where we were saying, it just, the fact that we're now saying that again.
Yeah.
You may have an empty chair next year. Don't do that. Did your
Yeah.
kids get vaccinated?
We sure did.
Yeah. Last time you were on, I think we were waiting for your younger one. Is that right?
Yeah, so the 10-year-old got vaccinated almost 2 weeks ago. So he'll be due the Monday after Thanksgiving.
Feels good to have
for
a fully
second dose.
vaccinated family, right?
Oh, I cannot even describe the relief that I felt. I was euphoric for that whole week after. And I couldn't really explain why. And then I was like, well, it's because he's vaccinated. And I can unload that anxiety that I didn't realize that I was carrying for this many months, that I have safely gotten my family almost to that finish line. So I'm excited for the holidays and being able to go into some of this without that fear and anxiety.
So and everybody knows that knows I love musicals, but Les Miserables, the song toward the end of the musical, empty chairs at empty tables. Think about it for just a moment. Why would you want that? It's one thing when you say, okay, well, they've had a heart attack or stroke or whatever, but this is just so easily preventable. And people say, well, it won't happen to me. Yeah, okay. Empty chairs and empty tables until it does.
Well, and it's important with the Delta variant to remember that this one is so much more transmissible that maybe you were able to run that risk before of, well, maybe it just won't find me. But when it is able to transmit as readily as this one does, you're really taking a serious gamble here. It's not really a question of if you're going to develop immunity to COVID-19 because of exposure, but when. And so when we have the means to protect you from the worst that COVID can throw at you, and we know that that's coming for you, then let's go ahead and take advantage of that tool.
So,
it's in 2 to 4 minutes, Hawk, and not the 8 to 12 minutes of the original variant, I think. Isn't that kind of the thinking right now with the Delta variant?
Yeah, we're learning more about the science of the virus for sure. Certainly it's some of those changes in spike protein that may make it easier to be cleaved, may make it easier to fuse with our membranes, even if we're exposed to less. And certainly if there are less receptors on our cells, we also know that we are learning that it can package more RNA into a single virus particle, and so therefore, when you have infection with this, it can create that infection and further replication even quicker and better. So I mean, there's a number of different things, and that is what we have seen. We're still learning more about it, but those are the initial takeaways. And we know that Alpha variant as well had other mechanisms to help reduce our own body's immune response to the virus. We're still looking to see if those types of things are similar in Delta as well.
Can we get to some community questions? Because we've got some good ones coming in, and we have some follow-up questions, so I do want to get to those. So let's get to a few questions that we missed from the week. Just a couple up the top. Will the University of Kansas Health System be holding booster clinics for those 18 and older in Kansas? Do we know about that?
Yeah, well, we do have a booster program, and I think there was a number you can call to do that. We're giving a lot of shots right now, and so I don't know that we're going to do quite the same degree of mass clinics that we did in the past, in part because there's so much availability for these shots at especially retail pharmacies, which have turned out to be a great mechanism. Wasn't sure how that was going to work back in the beginning of the pandemic. It's worked actually really well in grocery stores, et cetera. So you can go to find one in your health department. You can go to CVS, Walgreens, or whatever drugstore. And then the other thing that's true is that for the most part, primary care offices now have vaccine in them. So that's so much better than it was in the beginning. We have vaccine throughout our clinic, so if you come and see one of our providers, you can get a vaccine just from just about any clinic here.
Yeah, it's easy, and
It
that
is
makes a
actually lot
big
easier.
difference.
It's so much easier. Yep.
Dr. Schmidtke, jump in on this one. A question from the week was, why are we so low in vaccination rates? It feels like we are failing with this pandemic.
Oh, goodness. I feel that deep in my soul. I understand. What I would say is, of course, we've got some issues when it comes to trust in the vaccine, and that has certainly been one of our challenges is how do we make people more comfortable with the science? How do we make people more comfortable with what this vaccine is really doing for them? But there remain a lot of people that have not been accessed for this vaccine. I know that Dr. Stites mentioned how important it is that vaccines are now available or at your primary care physician, but a lot of people don't have a primary care physician. And a lot of people do shift work, and it's not convenient to go get those vaccines. And so one thing that we've seen be really successful in other areas, and perhaps here too, is when vaccines can be mobilized and taken to the workplace. And we can, meet people where they are. We've seen some rollout of vaccines available at schools for those 5 to 11-year-olds, 5 to 17-year-olds, but also in situations where the parents can get vaccinated, whole families can get vaccinated together, can be really impactful. So I think that we have more work that we can do to address vaccine access. Yes, we've had these vaccines for about 10 months now, and you would think that, anybody who wants one could have gotten one by now, but the reality is there are still a number of people who just haven't had the opportunity to do so because it has not been close to them, and they have not had the time to do so. So I think anything we could do to close that gap will help, but again, we have to continue to have these conversations to really build that rapport and trust, and that's what these guys do.
And there's still a lot of politics out there, unfortunately, and that's really played into this. And it strikes me, we're in healthcare, so we try to be pretty apolitical about this because we know that the virus is apolitical. But virus does not care if you're Republican or Democrat, right? It doesn't care if you're black or white. It's going to come for you. And so we tried to just describe the healthcare elements here. And again, there's just no question that these vaccines are safe. They're incredibly effective. They're far more effective than we ever imagined they could be. And they work for everyone. And so it's just, if we could just lay the politics aside and just looked at this as a healthcare question, there is really no question about what the right thing to do. There really is no question. And the good news is that 70% of Americans now have one shot. The problem is that here in the metropolitan area and throughout Kansas and Missouri, we are not at 70% or anywhere near that.
Okay, Jill has a question. And gosh, if only we knew. She says, do you know, are the unvaccinated wearing masks?
Well, so one thing that we wondered about when Jake and I were doing this study is we noticed that the death rate for certain areas was higher than others, and they had a lot of things in common. They were rural, they didn't have a mask requirement, and so what some of these things kind of speak to is a lack of safety culture, and that's a tone that really the leaders set for their community. And so one thing that I wonder about is when we have pockets of low vaccination rates, we more than likely are probably not seeing great mask wear, but I don't have data to speak to that specifically.
I love the turn of phrase that there is a lack of a safety culture, and that is true, and it extends perhaps beyond masking and beyond vaccination.
Mary says, excellent data. She appreciated the data. Yes. She wants to know if that study is available and that research is available somewhere online, and where can she go to get it? And also tell us a little bit about your blog.
Yeah, so no, we haven't put it online yet, but that's something Jake and I can talk about. I write a newsletter. It has an audience of about 30,000 people, and so it's possible that we could put it up there to make it available to people. And so right now it's just something that he was doing as a side project for this research class, but knowing what I did about this program and Jessica and the work that you all are doing, I saw these numbers and I saw that the cases were rising, and I was like, we have to say something now before things get so out of control that we can't turn down this momentum.
And we really appreciate that, because I do think, everybody was so happy that masks came off again, and that was great. But I think, Hawkeye, we've been saying the entire time, it's a little premature.
Mm-hmm.
Winter's coming.
Yeah.
Don't repeat the surge. Wouldn't it be better if we got more people vaccinated and got safer? And frankly, get us into the season of the Pfizer and Merck pills getting approved, which I think those are game changers. But instead, maskings came off, and again, what we would expect. Numbers start to rise a few weeks later. They really keep going up for 6 to 8 weeks. Hospitalizations travel 4 to 6 weeks behind the rise here. So we know that, again, right around Christmas, we're going to have a surge, Hawk.
Yeah, I think we have to assume that. And of course, here at the health system, we're always prepared for that. Even all of our respiratory therapists and our nurses who, we know their numbers are down. We know it is causing a stress on our workforce. But we are ready. We do have the capacity to do that. But unfortunately, just like you said, we are seeing cases in the United States, but also here locally, on those 7-day rolling averages, start to creep up fairly quickly. We know in 2 to 3 weeks, that's when the hospitalizations will start to come in as well.
Follow-up question from the week. Even with masks coming off, if I still wear a mask, do I still have some protection?
Yeah, actually, this was there was an article and a commentary published a couple weeks ago that showed that in those high-risk situations, even somebody who's wearing a mask in those situations where other people are not, in those indoor situations, when you're close to people, when you can't social distance, those do help to protect you from infection and exposure to the virus, even more so if you're vaccinated. So there is new recently published data on that as well.
So I work out inside, and I wear a mask. I was working out this morning, 5:30 a.m., and had a good workout. There were about 8 of us. We went to gym, and 3 of us were masked, 5 were not. And I've been doing it a couple times. And I always wear my mask. My daughter was with me. She wore her mask. Another friend wore their mask.
You're wearing the mask because you know you're going to be with people who are unmasked, and you don't know if
Yeah,
they're vaccinated.
and I'm
correct?
indoors, and I don't know what the story is. And you're in the gym, and you're breathing hard. So I'm like, you know what? Masking helps reduce the spread of disease. Both more, I think, about what you give to somebody else. But to your point, Hawk, we're all 3 of us are all vaccinated. We know that we put a mask on, we're going to be even safer.
Yeah.
So
Yep, and I've gone back and forth. When the number of 7-day rolling average cases is down, certainly my mask came off of the gym, but as it goes back up, it'll be back. It'll be back on. So certainly, for this past year and a half, it's certainly the mask on me has been on more times than not in that gym, in that small space area, than it has been off actually.
Do you think it's harder to?
breathe with a mask on inside while you're working out? Yes.
Yes. Okay.
And sweating into
But
it too.
to get used to wearing the mask that we did from the beginning, you know how we all just put on masks because that's what we were doing, but then to lift the mask mandate, then have to go back on again. I mean, do you think it's one of those things that we get comfortable not wearing it again?
Yeah,
we've been
I think
safe
nobody.
from it
Well,
so
and
far.
nobody wants to wear them, right? They're not. It's not like a party.
No.
Well, I guess it could be a party for Halloween or something. But in general, masking is it's a pain in the rear or a pain in your face. And so, but at the end of the day, what we've said all before long, I think I've said almost every day, the rules of infection prevention and control travel with you wherever you go. They keep you safe up until this moment and every day going forward.
I feel I've heard you say
Wear a
that
mask.
before.
I know you may have. I think I made it up just a couple.
100 or 200 times in the
know,
last.
I remember.
2
So
years.
that actually, I borrowed a lot of that from my former minister at Community Christian Church, Bob Hill, who would. But it wasn't about masking. I think he was talking about by the grace of God and things like that, which are obviously very important. But in this case, it's the grace of masking.
We don't mind a little sermon on
There
a
you
Friday.
go.
We all
It
probably
comes.
need a little bit of that.
It comes.
Okay. Another question. Aren't these new antiviral pills for COVID similar to Ivermectin? Dr. Hawkinson, a little Ivermectin question
God,
for you this
no.
morning. Just for
Yeah,
fun.
that's
Hawkeye, if you say yes to this, I'm walking out.
This is one of those easy ones. So
no,
let's move
I
through
think
this
that's
one.
a good question, and to compare and contrast these medicines again. Ivermectin is a very good drug. It's safe when used in those recommended doses, but it is an anti-parasitic drug. A parasite is totally different than a virus, which is totally different than a fungus, which is totally different than a bacteria. There were some early studies, especially on the benchtop in the lab, that showed maybe this drug at certain concentrations in the lab helps control virus, the ivermectin particularly. But when we get to humans, a lot of drugs and compounds have been shown that, but the time you get to humans and study on humans, it doesn't have any effect. And certainly we know that the dosing that would be used is really, in those early studies, would be necessarily toxic to humans. So that is a drug that was created for a totally different organism, a parasite, and it works well for that, and now it's trying to be repurposed for the virus. We should say that these new drugs have been around. We know that the Merck drug, I believe, has been around since SARS originally, so almost 20 years that has been looked at and studied. Although it stopped getting that because we know SARS went away, but this was a specific antiviral drug. They work in totally different mechanisms. In fact, the two antiviral drugs that are coming out really work in different mechanisms as well. But the short answer to that question is they are absolutely different. Ivermectin was an anti-parasitic drug. We know that these are specifically antiviral drugs, and so completely different. Nothing that really is the same at all. And these drugs are being created, formulated, and studied specifically for SARS-CoV-2 for this viral infection.
Dr. Schmidtke, do you think the promise of these antivirals is making counties and cities more comfortable lifting mask mandates?
It's interesting, and I think I've talked about this before here, that public health is really kind of a blend of the science, the microbiology and immunology, but also sociology. How do people behave? And so it's always hard to kind of get ahead of what people are thinking when we start to craft guidance and when we start to craft recommendations. So I think that in this case, it's possible that that is part of it. I think fatigue is playing a major role when it comes to counties and jurisdictions lifting their mask requirements. People are just ready to be done. And the unfortunate reality is that COVID-19 is not done with us. And so we need to continue to be careful and safe.
Okay, lots of questions. I'm going to try to burn through as many as I can.
Can we hit that Europe question in just a minute?
Do you want to talk about Europe?
Yeah, because
okay.
I think it's really instructive for us.
Okay, so why are we seeing a surge in Europe, and should we expect to see the same wave in the U.S.?
The answer is yes, we are going to see more in the U.S., and it's again, we already have a surge in the U.S. It's up 33% in the last 2 weeks. Mm-hmm. The areas of Europe are very much the same story as U.S. Eastern Europe is where it started, much more unvaccinated than Western Europe. Now it's moving into Western Europe. So vaccination helps protect you, but there's still an unvaccinated part of the population. And masks are off. And so Austria, Germany, now going back to mask mandates, now going back to social distancing. So it's the same story. Again, COVID doesn't care what country you live in. COVID doesn't care what political party you're a part of. COVID doesn't care what race or ethnicity you are. It's going to come to you if you don't follow the rules and if you don't get vaccinated and you don't do the things we talk about. That's what we keep talking about. Mm-hmm. COVID doesn't care. It most certainly doesn't care about you.
I think we always need to reset and talk about why is this important. It has a mortality rate of 0.05%, which is super small. Most people will be okay, but it's not just about the illnesses. It's about hospital capacity. It's about keeping people well so that they can be productive and work, so that we can have our supply chains that continue, so our economy can continue to grow and produce things and be there in the stores when we need to go get them. We know there's a huge supply chain issue. So it's not just about death, it's about overall people's health. And we know that countries that are healthy and productive, and those people are healthy and productive, do much better. And so we are really looking for that as well. It's not just the cases that we're talking about, but it is keeping people well, it is keeping our children well, keeping them in school, being able to leave the house every day to go to school, to learn, to get those vital lunches and those meals that are so important. And so, we hear that, this disease doesn't really kill as many people. It has a very, very low mortality rate, but it's not all about that. It's about really keeping people healthy, out of the hospital, keeping them productive, keeping the children well. Also, reducing long COVID, long haul. We know that the vaccines do that so that their quality of life is better, so you don't suffer from long-term fatigue, headache, shortness of breath, and things of that nature.
35 to 50% of people will develop long haul syndrome.
Yeah, and I was just going to say, one thing that I've challenged my students, not necessarily Jake's class, but another one this week to think about is we're about to approach 800,000 American deaths from COVID-19. And the challenge that I gave them was go back in time to the beginning of this thing and tell people what's going to happen. What messages would we give people to inspire them to act differently? And really, we're at a point right now where we need to be having that same conversation among ourselves. The people here on the panel with us today are telling us, or all of us are saying, we expect winter to be rough, right? So what can we do? What strategies can we implement to try to get ahead of some of that and to prevent any unnecessary suffering that we can? And so I think that the case is pretty clear.
Isaac wants to know, why is Platte County a lot lower, I wonder? As I recall, they got rid of their mask mandate earlier than some other counties. Also wondering if you have data for city of Kansas City, Missouri, or is it just county by county?
So, Jake may want to weigh in on this too, but I think we didn't look at the city itself. We did just look at counties. But Jake, did you want to make any comments about that?
No, I wasn't too sure. I know we didn't cover any like city by city data, but I wasn't too sure. We didn't really go into much as to why Platte County was so low.
But does it help to go county by county into those small pockets? Does that help you get better data about what you're seeing and why you're seeing it? I mean, again, culturally and just...
Yeah, I think it's important to remember, like Dr. Stites said, politics is everything in this too. And so, each county has had their own way of managing the pandemic, even though the virus doesn't really change across county borders. But they've all approached their response differently. And so we can learn from those who have done well. We can also learn from those who have not done well. We really didn't focus that much on those that did well. We will go back and look at that next. Mm-hmm. The ones that we really wanted to pay attention to were the ones that were suffering. And, what can we do to alleviate that suffering?
Yeah, and I would just say to those in Platte County who may hear this, remember also that people travel from one place to another. Mm-hmm. And so there can be a lot of things that happen around that. People in Platte County coming to more indoor arenas, or what's the rest of the story like amongst that population? And I would also say to you, watch out for this surge. Mm-hmm. If you look at Kansas right now, Western Kansas is really on fire. And, Hays has a lot of patients relative to, if you think about the size of the hospital versus KU and the size of the population area that we serve, the number of patients we see a day, and yet there was 12 today, we're at 23, we have 800 beds, they have 100 or 200 beds. So it's just, Hays is high, Western Kansas is really coming up, and it's all coming, if you look at this pattern, it's coming from the near west, like Colorado, Montana, et cetera, and moving into the eastern fringes. It's now moved across Kansas in the last few weeks. It's just coming to Missouri again, and so as far as this surge, and so I would say to the folks in Platte County, unless your vaccination rate's 80 or 85%, I would beware.
Okay, I'm going to try to rapid fire through a few questions for folks because we got some other things we got to get to. Okay, Howard says, if we do an IgG antibody test and still have a strong response, would you still recommend a booster?
Yeah, absolutely. So there is very good recommendations that doing these antibody tests, especially these commercial antibody tests, don't necessarily correlate with the amount of immunity that you have based on either past infection or vaccination or a combination of both. And so really no need to check those commercial antibody tests. The other thing is, on those commercial antibody tests, you don't really know exactly what the antibody is to. Is it to the N protein, which is another protein in the virus, which we don't make antibodies to if we've just had the vaccination? Or is it the spike protein? In addition, if it's the spike protein, is it really a neutralizing antibody, or is it just an antibody that's attaching to the spike protein? So really the overall recommendation is there's no need to check an antibody level. If you've been further out from your vaccination, again, I think the recommendation is 6 months or more, then you would be eligible for that booster. But really checking antibody tests is really not recommended.
Ray wants to know, how long after a COVID symptomatic infection should someone wait to get vaccinated?
until they're no longer symptomatic, and then they can go immediately. There was a bit of a confusion about should we wait 90 days?
Yeah.
And I think that was regarding convalescent sera, wasn't it?
Yeah, so I think there are the recommendation is really there is no minimum time between infection and vaccination. However, some expert opinion really remains dichotomous in this, and there is a large degree, because if you do have that infection, you do get that natural infection immunity boost. Even after you've had vaccination, you will start to maybe develop some specific antibodies, say, to that variant. Obviously, if you're being infected right now, you're going to be developing some mild specific antibodies for Delta variant. There's really no good answer to that question. The recommendation is there is no minimum time between getting infected and getting vaccinated, other than you want to wait that 10 days while you're isolating so you're not out spreading it in the community. But certainly waiting for a number of weeks after that infection, as your immune system now has kind of been boosted naturally, is reasonable as well.
Last question is from Taylor. I got asked this question and wasn't quite sure how to answer it, so let's help him out. How did pandemics go away before the days of vaccines if viruses continue to mutate and get more deadly in the unvaccinated only?
Well, it's interesting. I think, Hawkeye, you're probably best set up to answer this. It's part. We don't always know the answer to the question.
Yeah, so exactly. So we know that really almost all of the viruses, and remember we had Dr. Rackaniello on here a couple months ago, and just a great virologist, and he's talked about this as well. Most all of the viruses that infect humans came from animals and were spillover events ages ago. We know that the regular common cough, cold coronaviruses probably had spillover events a few hundred years ago to 1,000 years ago. It was different because, number one, you couldn't just hop on a plane and go anywhere you wanted within a matter of hours. The population wasn't as dense. How do these pandemics end? Certainly we understand that our body and our immune systems as a population, as a species, will become more used to it, and we won't have those things like we have the cytokine storm. We will just adapt to that. We know that our immune system adapts to these viruses. As viruses adapt, so do our immune responses as well. And I think it's just a matter of time. The issue with SARS-CoV-2, though, is number one, we have much more dense population now, as Dr. Schmidtke can attest to, than we did, 10 years ago, 20 years ago, 100 years ago. We have the ability to go anywhere in the world within a matter of hours, and so that changes things as well. That changes the dynamic. And even though, as we talked about this earlier, the mortality rates are low for sure compared to other illnesses such as SARS-CoV-1 or MERS, but the problem is we can't just allow natural infection, because we have seen the devastation that natural infection alone causes with just even a small segment of our populations around the world that have been infected. The capacity issues, the illnesses that continue to crop up, people going to the hospital. And so really vaccination is the best way out of this to help keep people protected and mostly out of the hospital, out of the ICU and dying.
Everyone, great questions today. I'm going to hang on to those. Stay put right there. We're going to get our final thoughts first, because we've got some really cute kids coming up and some fun announcements. So hang with us. So I want to start with Dr. Schmidtke and Jake. First of all, Jake, thank you so much for coming in today and just doing all this research for us and educating us. It's really great to have him on. So thanks
Absolutely.
for doing what you do with your
work that he's
students.
done.
So just your final thoughts, Dr. Schmidtke. What message do you want us to head out into the weekend with?
Well, I guess I would just remind people that, we have a lot of power here we have a lot of agency to make a big difference in what happens with this pandemic over the next couple months. And yes, I want you to get vaccinated. If you have not been vaccinated, go do that today. But we know that it's going to take time for that to really protect you. And so in the meantime, we really want you to be wearing a mask and making smart choices. The day of Thanksgiving, try to get one of those at-home tests and have that ready to go at home. Test before you go, because the very last thing we want to do is bring COVID with us to the celebration. So again, we have the tools to be smart here. Let's go ahead and use them.
Dr. Hawkinson, your final thought today.
Yeah, it's getting into this colder weather. We know the gathering season. We know that the cases, unfortunately, are going up. We assume and believe that hospitalizations will trail behind that. We know that this now is two pandemics, a pandemic of vaccinated persons and unvaccinated, with the unvaccinated persons obviously going to bear the brunt of those medical illnesses and those trips to the ICU and death. And so it's very important. Continue to get vaccinated. Maybe go today or go tomorrow and get your vaccine. That way you can stay home, enjoy the Chiefs game on Sunday, and just hang around. But you know that you're going to be developing that protection through the vaccine.
Sir, your final thoughts?
COVID doesn't care, so you have to. That's what keeps you safe. COVID doesn't care, so you have to.
That's a good message. And we're going to combine two of your favorite things, getting vaccinated and the Chiefs, all in one. Okay, so check this out. There is more than just football this Sunday at GEHA Field at Arrowhead Stadium, even though this is a big game for the Chiefs as they take on the Dallas Cowboys.
Chiefs beat the Cowboys. Boo.
So you can also take steps to help reduce your risk of ending up in the hospital and getting COVID. Okay, so check this out here on your screen. The health system is teaming up with the Kansas City Chiefs for a free COVID-19 vaccine and booster clinic. The event will run approximately about 11 a.m. to 3 p.m. This is near the Founders Club entrance on the Founders Plaza on the north side of the stadium. So the shots are free. They're available for kids 12 and up. Anyone 12 and up. The Pfizer vaccine will be given out to everyone, and parental consent is needed for those 12 to 17. Both Moderna and J&J are available for ages 18 and up. You can also get your booster shot if you are 65 and older or are 18 or have underlying medical conditions. Check all that out on your screen. I know that's a lot to take in. So if you're getting your second shot or booster, just make sure you bring your vaccination card and show proof of that. So making it pretty easy. Watch football.
That's pretty cool. Do it.
Watch football and get vaccinated.
Gotta
Okay.
do it.
Now we got a bunch of cute kids, brave kids that we want to show off this morning. So let's get started with Rhett and Bella. Check them out, showing off their guns. So thank you to kiddos for getting in line and getting that shot. So this is Hank and Sam. And I think little Lucy also proud to get their vaccination status upgraded. So that's fantastic. Thank you. And then Lindsay sent in these photos of her kiddos getting their shots like a champ, kind of documented the whole thing. Here, I want to go run through those because those are little cute kids. Those are Lindsay Norris's kids.
Mm-hmm.
So
very cute.
Cuties. Okay, I love it. So send in your pictures. Send in your pictures or videos if you documented them. You can send them to Facebook Messenger, to KU Hospital, or you can email them at medicalnewsnetwork@kumc.edu. There's that information. So get those sent in, and we're going to keep showing those throughout hopefully the next few months, and just showing kids. And
Get
we
more vaccine. Let's go.
Yeah, we want to really kind of honor them for setting good examples for everyone. Okay, so thank you so much, everyone, for being with us today. We want you to join us on Monday as we work to make sure that you can stay healthy mentally, as well as get ready for the holidays. Lots of holiday stress, we know it, but we're going to try to keep that as low as possible. So we're going to have 3 simple things that you can do that will make you feel grateful, proud, and happy. But before we go, we have some exciting news to share with you. Recently, we won another award for our coverage, a story that we told here at the health system. Here is our news director, Jill Chadwick, to tell us more about it.
Good morning, everyone. I'm so sorry I couldn't be there with you today, but I wanted to be the one to tell you how very proud I am of our team for bringing home another Emmy. This time, it's a National Share Care Emmy in the category of Health and Science News. We were finalists in 2 other categories, but it was a story by Jessica Lovell, Cliff Irwin, and Anthony Nickens that brought home the honors. Here with the official announcement is Dr. Sanjay Gupta. Take it away, Sanjay.
Health and science news can be overwhelming or even frightening. So yes, you have to give the news, but also take opportunities to showcase what is working. Allow people to see the light when they can. I always make sure to tell people not just the what, but also the why when it comes to talking about health recommendations for them and their family. It helps people feel knowledgeable, but also empowered. In that vein, I'm proud to present the ShareCare Emmy Award for Health and Science News to the University of Kansas Health System. Their incredible work, Tragedy Saves a Life, shares the inspiring story of how one family's loss saved a stranger. Organ donation is truly the ultimate gift. Great job.
The youngest one, she calls it her daddy bench.
Jay Liana's dad was David Reynolds. He was murdered in a road rage shooting in 2018. For Amanda, though, it's this man who helps keep the memory of David alive.
It's some kind of special.
Wow, what an absolute true honor for our team to be recognized by the Share Care organization. We cannot thank you enough. These powerful patient stories come to us from our advanced heart failure and transplant program, and we're just thrilled that we get a chance to tell them. We dedicate this award to David Reynolds and his family because it's through his ultimate gift of life that another life continues on. So thank you again for this honor from all of us here at the University of Kansas Health System.
Sweetheart, there's my girl. How are you?
It's a reunion that was never meant to happen. But what these two didn't realize at the time is this would be one of their last hugs before the pandemic hit. They were brought together by fate. To begin this story, we start where it ended, at the Ozark Memorial Cemetery in Joplin, Missouri.
We had more time to be alone with our own thoughts, and that was rough. With COVID, it forced us to face those.
It's been a year since that hug, and since we first met Amanda Reynolds. She comes here to remember.
Jayliana loves coming here. The youngest one, she calls it her daddy bench.
Jayliana's dad was David Reynolds. He was murdered in a road rage shooting in 2018. For Amanda, though, it's this man who helps keep the memory of David alive.
It's some kind of special. There's not a word for it.
David Shell, better known as Spider, suffered nearly 2 decades of heart problems that led to heart failure in 2018.
He had what's called ventricular tachycardia, which is basically a short-circuiting of a rhythm problem in the heart muscle itself. The first time I met Spider, I'm walking into his room saying, "Hi, I'm Dr. Sauer, you need a heart transplant."
You're waiting and you think, is this going to be reality? And all of a sudden, boom, it's reality.
While Spider lay dying of heart failure at the University of Kansas Health System, 160 miles south in Joplin, 27-year-old David Reynolds lay dying of a gunshot wound to the head.
And said, we just want to prepare you for what's going to happen.
David, an organ donor, was about to give the ultimate gift, his heart.
And the time came and they had to call it his time of death. And that was literally the hardest time of my life.
While Spider waited, Amanda said goodbye.
I just set my head on his chest. I listened to his heart, knowing that it was going to go help someone else.
And she was right.
I'm proud to carry that heart. I'm proud to carry this family. And it's something I'll carry to the best of my ability for the rest of my life.
He's my family now.
She's my hero. Her family is my hero, and she's right. We're family.
Spider is able to keep a piece of David alive. A part of him is still out there.
I feel like he rides on my shoulder every day. You know, I feel like I'm in good hands with the Lord and David right there.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.